You know how to save a patient, but you don't know how to save an ailing health system.
Hi everybody, I am Rox De Leon and this is episode 11 of A Curious Character. This episode is Conversation with Dr. Joey Hernandez. In this episode, Joey shared why he decided to pursue medicine, finding his passion in public health, his successes and failures in his medical career, and how he got into Johns Hopkins University's Master of Public Health program. Without further ado, let's get started with this episode. Welcome to A Curious Character. Today we have here with us Dr. Joey Hernandez, who is now doing his public MPH at Johns Hopkins University. Welcome to the show, Dr. Joey.
Hello, good evening from Baltimore. So good morning, Philippines, and thank you, Rox, for this opportunity to be in your podcast for this episode.
Yeah, thank you so much for accepting my invitation. So I guess maybe we could start with you telling us about your story. If you could tell us a bit about yourself, what's how did you get into medicine and all that.
Okay, so I'm Joey Hernandez. I'm 30 years old. So I'm a physician by training. So I did my uh, undergraduate training in 2006 to 2010 in Ateneo de Manila. So my undergraduate course was, or my pre-med was BS Biology back then. Tapos, pagkatapos nun, I did a series of trainings pa, medicine, and then 2 masters. So, bale, saan ko ba sisimulan yung kwento? I mean, shall I?
Yeah, you can talk about how you got interested with medicine in the first
Okay,
place.
sige. So, bale, kasi when I was in high school, so I studied in a science high school. And then I got really fascinated with biology and chemistry. So we had biology, chemistry, physics every year, plus calculus, advanced algebra. So very heavy scientific curriculum. So when college application started, I mostly chose science related courses. Like in UP, I think my choices were Doctor of Dental Medicine in Manila and the nursing.
Okay.
And then in Diliman, which was my second choice of campus, was chemical engineering, I think, and some other science course which I forgot. In Ateneo, my choices were biochem, physics, and then the last one I just left it like like English literature, just to explore another field. I think in UST my course was also nursing and medtech,
Okay.
and then Bicol University nursing. So it's all science because of my interest because of high school. I mean, my teachers back then taught science really well. So that made me too interested in science. And then I chose Ateneo after all because I was given a full scholarship generously funded by PCSO. So thank you,
Wow.
Philippine government, for funding actually my education throughout the years, starting from college. So I chose BS Bio, and then I didn't actually think I'll go into medicine because first, hindi kami well off to even pay for med school tuition. We're very much aware. I mean, my mom was actually just eyeing na parang Bicol University ako kasi affordable yung tuition. Sabi nga ng nanay ko, ang goal ko lang sa'yo actually, BU ka, which is like BU is a really good university.
Right.
But I mean, because of financial constraints, that's what we can only afford. So, and then parang surprise na nga lang na napunta ako sa Ateneo. So, hindi ko naisip yung med school first because of financial constraints. Second, it wasn't really in my radar because walang doktor sa family namin. So we came from a lower middle class family na parang hindi talaga mulat sa kung ano yung mga professional options. My mom worked in DOH
Mm-hmm.
as an HR. So medyo may alam ako ng konti sa public health because my mom used to bring home books na parang, like for example, merong sobrang manual on home remedies or community treatment for ganyan. minsan na uuwi niya sa bahay, binabasa ko, yun yung usual kong reading. When I was a kid, I didn't really like play a lot of sports, just badminton. I spent my days reading atlases, almanacs, which is very nerdy for a little boy. So then I got really interested in reading yung mga ganun na ano, like pag nasa CR ako habang nag-aantay ng ano, so babasa lang ng ganyan or whenever I have free time. So yun, and also my mom really brought home stickers from DOH, like yung mga Yossi Kadiri, which,
Yeah.
I mean, the early health promotion interventions, which feeling ko, pag pinagtagpi-tagpi lahat ng kwento ko, why I got into medicine, it was an early jump start for me na parang, meron nang na-inculcate na paano na parang may interest pala ako sa public health because of, ito yung mga little na mga fragments sa image sa at the back of my mind na parang which shaped my interest for public health. And then, so, hindi ko alam yung field before ng public health, hindi ko alam yung medicine. But then, everyone was, I mean, nasa Ateneo ako and we know na most of the students there are well off, no?
Yeah.
And children of doctors. So, nag-NMAT silang lahat, almost everyone, if not all. So, sabay din naman ako because, I mean, try lang, di ba? Luckily, I got into UP Med. Only 3 of us out of our batch in Ateneo got into UP Med. And then I also got into Ateneo Med, which offered me full scholarship as well. UP did not offer full scholarship back then. But then I was really leaning towards Ateneo, basically because it had a double degree option
Uh-huh.
and it was a more familiar environment because most of my friends opted to go to Ateneo or and UST. So sabi ko, doon na lang. Tsaka I know how Ateneo takes care of its scholars. So bale, ang ending, last day na nung pag-confirm sa Ateneo, I asked my mom, ma, saan ako papasok? UP Ateneo. My mom answered, UP na lang. So I opted for UP Med. Well, it wasn't like a bad choice after all. I mean, it's UP PGH. Tapos, I got selected for a Pinoy MD scholarship.
Wow.
So we were 4 Pinoy MD scholars in our UP Med batch. It was funded by, thank you ulit, DOH, Philippine government for funding everything for my med school. Bale, I also got into UP Med because of regionalization program. Hindi ko alam kung familiar kayo sa regionalization
No.
program. But you know how UP Med's admission process is too competitive. GWA, I think 2.5 or better, and math score of 90 percentile and above, meaning you have to be top
Wow.
10% of the country in terms of that exam. Also, you have to pass the interview. So parang for you to bypass that rigorous criteria, you have you can do the option of signing up for regionalization program, which aims na its graduates will go back to the regions and serve underserved areas. So ang kapalit nun, less competitive admission process. So parang ang nangyari nun, so I signed up for that kasi from Bicol ako, so I qualified. Tapos may 4 na candidates from Bicol region. So we
Mhm.
went first for an interview in Naga City. Merong regional level. Then may national sa UP Med na, which was the real admission. Tapos from 4, 2 kaming natanggap. So so sa batch namin of 120 na lateral entrance, kasi may 40 na intermed.
Mhm.
120 ang lateral, yung mga nag-college, nag 4-year
Mhm.
college or 5 years. So, out of the 120, 22 kaming regionalization students. So we joined the batch of UP Med class of 2015, sorry, 2015. So then, actually, so yun, sabi ko, ang reason ko for getting into med school actually, I honestly, nung college, I went to med school kasi I still don't know what I was going to do with my life. Like I had a BS Bio degree. The usual path is to go into postgrad, master's, PhD, go to the academe, go do research, yung mga marine or mga taxonomy, ganyan, environmental biology. But these things were parang hindi ako pa masyadong inclined into doing, or I think I wasn't ready that much because I graduated college 19. So parang feeling ko sobrang hindi ko pa alam talaga kung anong gagawin ko. So I went into med school thinking na it's a win-win situation. I can buy time into really figuring things out what I really want in life. Pero it's not bad because I will have an MD after all. I will get to help people. So parang kahit di ko siya ma-figure out, I have an MD. That will be an easy choice for me, and I will be spending my life uh, parang wise use of my time because I will get to help people. I have an MD. So parang win-win talaga siyang
Right.
situation.
Right. So
So,
did you have parang you had the positive outlook going into med school? Because when you think about it, it's like another 4 years of your life studying. How were
mm,
you feeling the time that you were about to graduate from undergrad? Because others would
mm,
feel burnt out, like another 4 years or more of my life
yeah.
studying. How did you take that?
So, yeah, sobra kasing nakakatulong, I guess, that Ateneo had a very chill environment. It was academically rigorous, but madami kasing extracurriculars. Tapos, feeling ko nakatulong yung environment, yung surroundings ng Ateneo na ang daming puno. I lived in the dorm inside.
Mhm.
Malakas yung social support. Malakas din yung, aside from the technical biology side, malakas yung humanity side that makes you introspect really, na parang it made you whole, na parang ganon. So parang hindi ako na burn out sa college. It made me learn more about myself. So parang nadala siya sa med school na parang college wasn't really toxic for me. So parang ganun yung outlook ko going to med. I still want to learn more as well. So kaya ganun yung naging, ay parang hindi ko siya naisip na it's gonna be 5 more years of my life.
Right.
Also, I was 19 back then. So parang hindi pa din ako ready to go out into the real world to like to be in the dog eat dog world na
Mhm.
ng employment. So sabi
Right.
ko, I think med school would
Yeah.
be a great option.
And it's an interesting perspective also, you coming from Ateneo and undergrad and switching into UP. Parang it's a different culture eh.
Sobra.
You know, a lot of people who go into UP Med also went to UP from undergrad. While there is
Yeah,
a transition, no, iba yung
of
shift
course.
from private to public school, no.
Totoo yan. Sa batch namin na 160, I think 9 lang kaming non-UP. Tapos, 5 kami from Ateneo. So it was really culture shock. Kasi I mean, Diliman campus would be much closer to Ateneo. Puno, yung mga tao, very chill, going to school with their chinelas and all. UP Manila was a different environment because it was in Pedro Hill, Taft Avenue, so
Yeah.
bustling, so
Yeah.
busy every day.
Yeah.
So ngayon, actually medyo may konting culture shock. Kasi first, most of the students there know each other from college. May mga grupo-grupo na. And we
Mm-hmm.
were quite isolated actually nung una kasi parang mga taga-Ateneo to, mga snob siguro or something. So it was really hard to sort of make a lot of friends because they were already friends to begin with. So yun, also yung campus and also parang balancing the parang nakakagulat na workload bigla sa med school, yung aral-aral every day. So it was really tough.
Yeah. How was your med school experience? For the 4 years, no, yung med school.
Oo. Pero sa sa UP kasi parang tinitingnan namin siyang 5 years kasi we graduate after internship, which is unlike
Okay.
the rest of the med schools, no? So bale, in general, the first 2 years of med school, parang sanay na. Nag-aaral every day. We count days in terms of how many days before exams na parang Monday ngayon, 5 days before exam. Parang gano'n, na parang Monday to Saturday or Sunday would be the same except may klase ka ng 8 to 5. So parang same lang. Babasa ka lang everyday, ganun ganyan. Honestly, I liked it because nerd ako. So parang gusto ko talagang nagbabasa, nag-aaral. Ang kalaban mo lang talaga doon ay oras. Um, I also made a lot of friends. Like I have a constant barkada na 16 kaming boys. We went on trips pag weekend, ganyan. I plan trips for them. Tapos I keep a very social and parang strong social support or strong social network. Tapos nung clinical, actually admittedly it was very tough. I was coming from a, background kasi na hindi nag-clinical noon, like nursing, medtech, PT,
Mm-hmm.
na may parang head start na sila na parang they know how to insert IV, they know how to do mga kung ano-ano mga clinical procedures, but hindi ko alam, 'di ba? So, yun, medyo mahirap din yun. Tapos, you go on more than 24 hours for duty, wala masyadong bigo. But then I had moments before wherein I wanted to sort of quit, but sabi ko I cannot because yun nga parang nire-remind ko parang why I'm here, the Philippine government paid for your tuition, you should be at least, sabi ko konting push na lang, yung mga ganung mga self-pep talk
Yeah.
until yun nga thank you Lord na nakatapos ng medicine in 2015 on time. So yun.
Nice. So is it part of the regionalization program yung doctors to the barrio na part component
Mm-mm.
ng med school? Or it's after med school already, no? So parang
Yeah.
afterwards.
Actually, it was when regionalization program was conceptualized, I think super noon pa parang yung DTTB, konti pa lang kasi nagdo-doctor sa Barrios, no? Tapos nung time ko, parang unti-unti na siyang dumadami. So naging na siyang palatable option for doctors. So counted naman siya kasi you also go into underserved areas.
Right.
So it was an easy choice to make. And also, because I'm a Pinoy MD scholar, I was required actually to be a DTTB for at least 2 years. So yun yung condition, which
Okay.
initially, syempre, yung mga most of your batchmates are going into residency. Initially, I thought of it as parang sabi ko, pagkatapos nito, mag-residency ako. I initially wanted to do neurology. However, yun nga, sobrang turning point ng Dr. Sudabario's experience. Kaya ako napunta dito sa public health.
Oh, and paano yung doctors sa the barrio? Like, how do you choose where you'll go? Which part of the
Mm-mm.
Philippines you'll be going?
Bale, yung doctors of the barrios kasi, karamihan nung time kasi namin, we were the last batch of Pinoy MD scholars. So most of the DTTBs were Pinoy MD scholars. So bale, ang priority, you go back to your home region. Kung ayaw mo naman, home region mo, you have to compete for slots in a different region kung saan mo gusto. Especially kung taga Manila ka and you volunteered tapos wala kang province or region. So yun, may mga criteria which we set kaming mga DTTBs. So ako, sabi ko, I'll go back to Bicol region because first, walang language barrier. Second, my familiarity with the scene. Parang, there are kasi cases na ay parang madami, ang laki ng effect na alam mo yung nuances, yung cultural
Mhm.
nuances. Tapos yung mga language, yung pagka-unique ng language. Kasi mas mapipick up mo yun from patients, kahit di nila sabihin verbally, minsan masisense mo, feel mo. So yun, there were only parang a few municipalities na open na recommended by DOH Regional Office na sinabi nila sa Central, these are the municipalities na bubuksan namin for deployment, which mostly are doctorless areas, meaning wala talaga silang municipal health officer. So you have to assume that role as an OIC. Or if there is an MHO, ang criteria kasi parang 1:20,000 people, one doctor sa 20,000. If the population is big and there's still parang underserved geographic area, you can enter. So ako, yung first area of deployment ko was Camarines Norte. My second was in Albay. So yun.
Okay. So parang interesting transition and you kind of touched on it earlier na parang yung doctors to the barrio experience was like your eye opener and you
Yeah.
realized that you wanted to get into public health. So
Yeah.
when did that parang decision making process come in? Okay, I'm gonna apply for a master's of public health. I think you kind of touched on it in
Yeah.
your previous tweets, like you got rejected in so many scholarships and all.
Yes. Yeah.
Could you talk about siguro those rejections and then how you
Uh,
landed
si, si,
to the Hopkins?
Siguro I'll start muna with DTTB kasi yung DTTB kasi may kasabay siyang masters in public management, major in health systems and development. So para siyang perk siya of being a DTTB, we will give you we will allow you to study. We will fund your studies. Thank you, DOH, for a health systems, a public management major in health systems degree. So this was care of Development Academy of the Philippines. The goal kasi was for you to be able to be parang a competent local health systems manager, which was parang very like yung mga subjects namin, leadership and governance, mga management analysis, organizational management. So we learn these things. Pagpunta ko actually sa barrio, ibang-iba yung medical curriculum. Yung training namin, I mean, feeling ko pag may mahimatay diyan, alam ko gagawin with pasintabi, with confidence talaga. Kayang-kaya ko yan. Kasi I mean, PGH trained me for this.
Yeah.
But then, I mean, being a DTTP kasi, ang daming administrative side, ang daming managerial side, na parang yung masters kasi papa-start pa lang, but we didn't know kung ano. So parang DTTB made me realize there are a lot of things I still don't know. Meron kasing trap na parang galing akong UP Med, so I must know everything. Na parang I know how to do this, ganyan. I mean, clinical, sure, but it's also a humbling and character forming experience na parang it makes you realize you don't know a lot. You know how to save a patient, but you don't know how to save an ailing health system. Oh my God, sobrang
Oh,
hindi na tinuro sa amin before. My God, paano ako magre-refer ng pasyente na ganito na parang wala akong ambulansya, anong gagawin kong plano? Nag-work ba yung mga pinapagawa ko sa mga staff ko? Hala, may pondo akong 10 million. Saan ko ba i-allocate to? Oh, nag-allocate ako ng 5 million for this program. Nag-work ba to? So parang ang dami kong hindi alam. Which also, the Masters in Public Management, although very helpful siya sa akin, meron din naman actually mga kulang pa din because it wasn't really, I mean, feeling ko yung Masters in Public Health kasi, Masters in Public Management, they serve different purposes. Yung MPH kasi was to for you to gain more technical expertise in the different fields of public health, while public management, yung MPM namin was for parang ground experience, groundwork. So yun, actually, yung realization ko for MPH came parang mas stronger, mas na-affirm siya during the next few years of my career when I got out of DTTB. When I worked sa parang with DOH on a national scale, parang hindi enough na MD ako, hindi enough na may MPM pa ako. Kailangan pa ng mas ng isa pang degree to help me to be technically competent. Kasi nagbago yung career ko totally. Mas naging technical and project management yung role. Kaya may ganun. So, ano pa nga yung question? Sorry.
right. So parang ano, no? So parang hindi ka na practicing in the clinic. More like how do you yung management side of being a medical practitioner.
Yeah, yung sa DTTB kasi actually mas nung MHO ako because I switched kasi to Rapu-Rapu Albay which was nearer. Doon parang yung clinics ko was only taking up 20% of my time. My time was being spent a lot on meetings with different departments, budget, environment, local government. They were asking me to provide plans for the next year, how to evaluate programs. So ang daming iisipin mo paperwork, scat work, but it's not. It's actually the meat of public health work. It's not, I mean, patient encounters also, but I think these are yung parang underemphasized roles of a physician na hindi lang dapat alam siya ng public health physician, but actually I think every medical
Yes.
student deserves to know because
Right.
sa ngayon, lahat ng bagay, parang I don't think there would be a purely clinical practice. Even if you are seeing patients, like sabihin natin full-time, from Monday to Friday, yung mga pinanggagalingan ng mga pasyente mo, there is a public health aspect to it that you have to deal with. Ay, Doc, hindi po ako nakapag-consulta kasi wala kaming pera, kaya lumaki yung tumor ko. I mean, you cannot deny there's a public health touch to it. So you have to deal with it na parang the right way. So I think kaya yon parang ano dito may parang I think from the guide na parang what's your passion here is it's parang i-touch on ko na briefly na yung isang passion ko would be to at least push for stronger public health ano ba pa yung parang aspect in the medical curriculum in the country because we need more public health, I mean doctors who know how to do public health even if they don't choose it after all.
Yeah, I love that. I love everything you said about that. Especially yung kanina when you said you know how to save patient but you don't how do you save an ailing healthcare system? And super yes on that public health component for med school. I did not go to med school obviously, but personally I feel like in engineering we also need that because we touch ko na rin on that topic because in engineering we get taught a lot about how do you design this, how do you wire this circuit, blah blah blah, and all that. But we lack that humanity component. Well, we do take GEs, no, arts and humanities as part of our courses in undergrad, but yung parang grounding yourself to what's really happening in the community, it's something that will give us a perspective of, okay, what problem do we have to solve? And especially now with the UHC. No? So parang,
Mm-mm.
I just happened to parang stumble upon this UHC because I'm very interested in how do we bridge engineering and medicine, and really a huge component of that is understanding where the problem is coming from.
Yeah.
And I think that's one thing that I really found interesting about your story is, yeah, bridging public health and medicine, and how can you make a difference with this profession that you chose to go
Mm-mm.
to. So I love everything that you said about that. I mean,
Salamat.
yeah.
Yun nga din, parang surprising din actually na parang malaki apparently, feeling ko na yung parang disconnect nila all the while. Kasi parang nung med school, wala masyadong nakakaisip to go into public health, na parang everyone was talking about what specialty will you go into, surgery,
Mm-hmm.
IM, but no one was really talking about going into public health. I think parang I and a few friends were, I mean, yung mga Pinoy MD, kami-kami lang yung parang mukhang public health kasi required kami. But beyond that, no one was really thinking about doing public health beyond it. So yun, actually for us, 13 kami dito TB sa batch sa UP Med, I think it was really a turning point kasi majority sa amin hindi na nag-clinics talaga. Went
Wow.
into as in legit public health practice.
Love it.
So
Nice. Yeah, and many other people would go into academic research, MD, PhD. So salute also to those MD, PhD
of
students
course,
studying 10 years and then finishing your degree, and then realizing that ang hirap pala ng funding sa Pilipinas, that you cannot
I
work
know.
on the bench work that you want to work on. So it's a constant struggle, but
Mm-mm.
for sure grateful for all those people who, are thinking for the future of, okay, how do we improve healthcare, how do we expand healthcare access in the Philippines. And I guess for you, yung next step to that path is pursuing a public health degree.
Mm-mm.
So maybe we can talk about how did you end up going to Johns Hopkins, and did you
Okay.
consider applying to other universities also?
Yeah. Actually, yung scholarship journey ko, it's kasi nag-work na ako for total of 3 years outside of DTB as a public health, parang consultant for various projects. So mainly technical and project management work. Then I realized, kasi yung iba kasi, may masters na ako, MD, MPM, di ba? It's parang, not a lot of doctors get another masters. So parang, meron kasing trap na parang dami mo nang alam. But along the way, when I was parang sitting in DOH discussion tables or PhilHealth, ganyan, I realized, shucks, I still don't know a lot of things. I think I need another degree. I didn't think of going into PhD kasi sabi ko, it's a long commitment, 3 to 5 years. Masters would be perfect because masters, di ba, kasi you need to master, parang it's gaining mastery of things compared to PhD na parang you have to generate new knowledge, ganyan ganyan, which was, I think, for me parang stretch pa masyado at this point in
Mm-hmm.
time. And feeling ko kasi hindi ko pa master yung mga bagay-bagay. So I think I need another masters. And also nakatulong yung boss ko din. MD siya, may MPH from UP and may Masters of Science sa London School of Hygiene. So parang sabi ko, sige, baka ganito rin yung track na gugustuhin ko. So since 2018, I've been applying to different scholarships. It wasn't an e-lit. The first scholarship I applied was Shivning, 2018. I was supposed, ang choices ko were UCL, this health economics and decision science, and London School of Hygiene, but I got rejected by Shivning. I tried Shivning again the next year. I got into the wait list. They sent 37 people the previous year, but they only sent 28 the next year. I was really hoping to get in kasi parang but apparently mo hindi sa wait list and hindi rin nakapasok. I also applied in Erasmus Mundus. I got in,
Okay.
but I was also waitlisted for the scholarship. So ang ending wala din. I applied in Australia Awards for, I think, an MPH in Sydney, but hindi rin ako nakapasok. So sobrang um, rejections talaga siya. I didn't bother applying na sa local because I think I need an international
Right.
experience which would bring in the international flavor of things. Kasi parang I mean, UP is a great program for MPH, but I think I need to expand my horizons, parang know how these like US or UK did it.
Yeah.
Especially UK. Kaya din
Yeah.
UK talaga yung inaay ko because they have NHS, they have a good public health system. I need to learn from that. So kaya din UK yung ano ko. So parang I could contextualize and bring home something useful for the country. I was actually parang starting it, kasi parang ang sa London School, ang major ko dapat was health promotion. So I was actually parang starting initial discussions now with some people in there na parang I've worked with, na sabi ko, oh, mukha pong magma-masters ako sa London School of Hygiene na health promotion. Baka po may research question kayo dyan na gusto nyong ipa-thesis ko, ganyan-ganyan. Para naman useful yung gagawin ko, hindi siya parang put into waste. But then, life has other plans. Actually, I applied for Fulbright. Um, applied for Fulbright as sabi ko, so sobrang dami ko ng rejections din, and so medyo nanghina na din yung loob ko, sabi ko Fulbright na yung last, and ayoko na. Tapos nakatulong na yung pinsan ko ay Fulbright scholar din. PhD siya dito sa Texas A&M. So parang nagtatanong ako sa kuya ko, paano ba to? Ganyan. Parang actually ang daming barriers to Fulbright. Like, apat pala yung recommendation ng kailangan. Sa shifting, dalawa lang. Ganyan. Sobrang toxic niya na parang yung application ng Fulbright. To the point na, sorry Fulbright pero medyo kasi mas demanding yung application ng Fulbright na actually worth it naman. To the point na ang deadline was March 25. Nagsabit ako March 25, 4:30 p.m. as in closing. Kasi parang nag-iisip ako, sobrang kulang pa ako ng recommendation, sobrang wala lang akong gana mag-apply. Kasi parang ulit-ulit na talaga yung essays mo, babaguhin mo lang ng konti, ganyan. So yun, sinabit ko. And then I was called for an interview. Parang nagulat nga ako na parang ngayon. So parang nag-interview ako. It was a panel of 9 people there. Sobrang nagulat ako kasi sa evening, 3 lang nag-interview sa'yo. Pasok ka, siyam. As the interview was very unique, na parang the questions were non-technical. I mean, full evening interviews were about leadership, about networking, about your career plans, your technical field, but Fulbright was different. Like, how will you survive winters in the US? Do you have nag-give away na ba ako ng interview
No.
questions? Pero yung mga ganun, it was more personal than, so parang ako, shucks, nasagot ko ba ito ng maayos? May feeling ako na parang nasungitan ko na yung Fulbright kasi parang there was one question na parang, how can we be sure that you will go back to the Philippines? Kasi Fulbright is a return
service also.
Parang ganun of 2 years. Sabi ko, my family's in the Philippines, my friends are here, my life is here, tapos ganyan. Convince us more. Ayun po, since bata ako, yun talaga yung inclination ko, yung background ko po, DTTB ako, ganyan. So parang naubusan ako ng rason. Tapos parang sinabi pa nila, can you give us more reasons? Parang nasungitan ko na nga, sabi ko, I have no more reasons to tell you, I gave you everything. Sabi ko, paglabas ko ng interview room, shit mo, hindi pala ako matatanggap dito kasi sinungitan ako. Tapos parang pagod ako.
Filipinos ba yung nag-interview? Or American?
Executive director, yung staff, and then alumni. So, all Filipinos. So,
and you were doing all these applications while having a full-time job, tama ba? Or,
yeah, oo.
I can imagine the stress.
So parang ganun. So parang, ayun, yung malulungkot ka, di ka natanggap, parang ready ka na. Actually, so yun. Tapos, bigla kaming pinatawag for some parang dinner party. O bakit nag-email yung Fulbright na invite tayo sa party, hindi pa nga tayo nakatanggap. So doon pala sa party sinabi na we were the chosen ones for Fulbright.
Wow. So Fulbright scholarship is it 2 years na
Depende sa program mo. Depende sa program. So it was a mix of 12 principal candidates, meaning yung parang first priority. Candidates yung tawag kasi we have to go through a process pa of university admissions, which was unlike other scholarships.
Yeah. Okay, so essentially, you applied for Fulbright if you were in the US for fall 2020 ba? Yung start ng MPH.
Natanggap ako 2019 pa, June 2019.
June 2019 before you applied for Hopkins.
Wala pang school. The school comes after.
Okay.
So may funding ka na, you just don't know where. Yun yung iba. Kasi sa iba, evening, di ba, sabayan. Australia sabay. Ito iba, di mo alam kung saan ka you have to be placed in a university. Kaya candidates pa yung tawag sa'yo because if no university accepts you, wala kang Fulbright grant.
Interesting. I should have applied.
You should. Oo.
I should have applied because I remember nung for my masters, it was I got into Berkeley ng fall 2018. So I applied sa school. I did not know if I'll get in, etc. Then when I finally got in, around March, I received my acceptance letter. I'm like, oh no, how do I fund my studies? And
Mm.
fortunately, mayroong Picari scholarship noon that gives funding for Filipinos pursuing masters in UC Berkeley. So I got that. But then I realized, yeah, I looked into Fulbright, but apparently for 2018, they're getting applications for those entering ng fall 2019. So out of the picture na
Yes.
pala siya.
Mm.
Okay, so that's one thing, no? Okay.
Yeah, kaya nagwo-work siya if you don't have acceptance letter pa kasi um next year pa talaga siya na you have to go through TOEFL, GRE after Fulbright funds it for you. Pati yung placements and all, pati yung applications.
Okay.
Actually, because Fulbright asked us apat na universities where we want to send the applications. So it was the same application, the same essays, same recommendations. But we were asked to select one dream school and three affordable schools kasi may funding cap. Kasi 'di ba fixed yung funds. Like the other scholarships na parang sky is the limit I guess with the school na parang Oxford yan, ganyan. I mean, we will fund it because Foreign Commonwealth Office, Crown of UK yung nagsa-sponsor. But ito kasi parang different yung setup. So one ideal, so it was either, I had a hard time, um, I had a hard time thinking, parang deciding if it's Harvard or Hopkins. They're the two best in the world. Tapos three affordable schools na within the budget cap. So sabi sa akin ng program officer, I am the second doctor who was funded for a Fulbright scholarship in the history. So, may mga din before health informatics and ganyan. The first one was Beverly Ho, the director of
Yeah, yeah.
promotion. So, medyo na-pressure ako. So, sabi ko, si Bev nag-Harvard na. Sige, mag-Hopkins naman ako. So, parang ganyan. Para lang naman maiba akong brand. So, parang ganyan. So, and then I chose University of North Carolina, Chapel Hill, which was ranked 3. So, rankings based yung ko kasi parang if mag-aaral na ako, I'll choose parang the best schools. I also chose University of Washington in Seattle.
Okay. Seattle.
And then UC Berkeley.
UC Berkeley, yeah.
Yeah. So actually, yung UC Berkeley daw, super competitive daw sabi ng Fulbright. Palitan na lang natin yung UC Berkeley mo. So they changed it to Georgia State University. So I got accepted in all of them. Tapos, titanong ko na Fulbright, where do you want to study? Pwede po bang Hopkins? Sure. So yun.
Wow.
So actually may shortfall kasi yung funding, yung expenses sa Hopkins ko was so high because it costs a lot to study in Johns Hopkins. So actually Fulbright, tapos nag-chip in yung university. So I have an added scholarship sa Johns Hopkins. Kaya din, as may konti akong cost share, which is very minimal, pero most of it, like 95% is covered by these two organizations who chipped in.
Wow. Ganda. Well, and side note dun sa UC Berkeley MPH, I actually took a MPH elective, health policy and decision making, and that actually opened my eyes of what the considerations are that people have to consider if they are pushing for this health technology. Because from my perspective, I went into that course thinking, as an engineer, if I have this technology and I want this to be commercialized or utilized by the public, how do I do that? And apparently in the States, and interestingly with the health care system of the US, and it's something that I don't think we should adapt really because it's weird and it's like very, very commercial focused. Apparently, okay, meron pa pala mga pricing considerations, etc. And interesting how different people, because my classmates there, meron people from my program, merong MPH students, meron mga doctors talaga and people who went straight out of undergrad. I'm not sure if I think they went straight out of undergrad and then did their MPH. And just interesting how people could, talk about a topic with different perspectives. So, yeah, for sure, it's an interesting experience and something that we could adapt or maybe bring back to the perspective.
Yeah. Parang bago pa lang din, I think yung kasi parang may mga initiatives na before for mga ganyan, mga innovation, biomedical innovation, public health innovation, but Feeling ko parang ngayon yung fast rise, kasi I am now seeing people like public health figures who are actively taking on that career, like public health innovation, who studied abroad, working parang professional track talaga nila yan. So also with the formation of HTA, Health
Mm-hmm.
Technology Assessment Unit, na parang mas na-formalize tuloy how do we decide on which devices to adapt and to promote for public use, yung mga ganun. So actually, mas nagtitake shape na ngayon yung public health with these fields na
Yeah.
apparently parang foreign before sa atin but has been existing in other countries. So yun, it's actually very bright for public health, especially madaming umuuwi ng nag-aral abroad and actively
Right.
applying those in the Philippine public health scene. And
Yeah,
collaborating
exciting.
with other sectors, no, na parang you will see how public health touches a lot of fields. Hindi lang engineering, ang dami pa, di ba? Even architecture, how,
Yeah.
pa ba?
Economics.
Economics, lahat, ang dami ng health
Right.
economists ngayon from both health and economic side, because I know people na parang PhD economics pero ang track niya ngayon ay health economics. Meron din namang doktor nag-health economics din. So parang ang galing kasi they all come from different perspectives, but then they all are doing or are aiming for the same thing. So parang
Yeah.
sobrang covered ko ano man ang mga gaps in terms of information, knowledge, experience.
Yeah, and perfect timing with the implementation of UHC. So parang we're starting talaga, 'di ba? From
Yeah,
to something new. So it's a perfect opportunity for young
of
professionals
course.
and those who are trying to, transition to a more public health focused
Yeah.
career. So exciting. And yeah, maybe siguro going back to the Hopkins experience. So parang just to clarify. So did Fulbright, parang did they have a say on which schools you would be applying for dun sa four?
Actually, of course, they have a say. And actually, four kasi yung a-applyan talaga nila. So they just asked me for four choices. Yun nga, yung may say sila kasi pinalitan nila yung Berkeley with Georgia State, which a lot of Fulbrighters parang doon nag-take ng MPH. So parang it was an easy pick siguro. Parang mas sure na feeling matatanggap dito kasi a lot of Fulbrighters went to this school. So yun, so may say sila talaga sa pipiliin mo. But in the end, yung choice of final school is a negotiation based on funds, based on kung ano man na set up ang kailangan. So yun, fortunately, blessed naman na they agreed to place me in Johns Hopkins, which was really expensive. So madaming ginawang like ways din on how to raise funds. So yun, mabuti na lang yung Hopkins nag-yes din with another with funding pa. So
Yeah.
yun.
Yeah. And how's your experience so far? Moving into Johns Hopkins, how was the big move
Oo.
like and getting there
Yeah,
in a
actually
pandemic?
sobrang sobrang unique I guess nung experience because dahil pandemic, everything was done online and nag-overlap kasi yung work and studies na parang um, in limbo pa kasi yung pag-alis namin before. Nakaalis na ako December. Initially, it was June, then maging August. Ang unique with Hopkins, the fall semester, the school year starts June 29. Sobrang aga. Na parang hindi pa ako nakaka-resign sa work. Parang I was still working but nag-aaral na ako kasi wala pang
Mhm.
certainty nga with when I was supposed to leave for the States. Sabi ko, sasagarin ko na kasi ang hirap din namang manirahan sa Manila at mabuhay sa Manila nung wala kang trabaho. Tapos may allowance pero still syempre mas maganda yung may added income ka. So I was actually juggling a full-time work na 8 to 5 under a project ng USAID. Tapos sa gabi yung classes ko. So
Wow.
until wee hours of the morning, I was at 3 a.m. Gising na gising ako, nagdi-discuss, nagpe-present,
Right.
then at 8 o'clock, I have to wake up for a meeting. Mabuti na lang online, actually, because if not, the traffic would have to be parang factored in or I would have to give up work talaga.
Yeah.
So yun, I had to juggle that. Sobrang hirap din because I think na-realize ko na ayun, it's an 11-month program compared to the other public health schools na 2 years yung ano. So you have like time to breathe. I think konting schools nag-offer lang ng super compressed MPH. Hopkins, Harvard, UC Berkeley has a 1-year
Mhm.
MPH. So, yung mga ganun. So, sabi ko, sulitin ko na lang din ang tuition. Mahal masyado. Kasi after, parang pag naka 13 units ka per sem, you can take as much as 22, hindi akit yung tuition fee mo. So, sinasagad ko siya.
Mm.
Because I want to learn as much. So, parang once lang to in my life. So, kaya din, medyo siguro pagod ako because I'm taking 21.5 every sem, 20.5. Kasi gusto ko talagang matuto ng madami na coursework. So, yun. So far, sobrang hectic kasi yun nga, you have to really budget your time well. Time zone differences most especially. I'm a morning person even if I sleep at 4 in the morning, kakatan ng class, magigising pa rin ako ng 8. So parang, so ganun talaga siya. Tapos, ano pa ba? Yung personal life mo din, COVID, syempre madami din namang friends or family members who seek your help since parang they know you're a doctor in public health, so you must be able to help them, yung mga ganun. So as juggling all of these, honestly, I'm also struggling with my studies kasi parang perfect kasi to study epidemiology right now because of the need for the
Mhm.
pandemic, and I think it will be very useful even in the future. So kaya yun naaral ko. I'm not so good with math because epidemiology and biostatistics yung concentration ko. So yun, struggling ako academically because I know parang I cannot parang speak in math language anymore, like all of these. So mahirap siya actually, but I know I will parang ano na lang, sobrang forward thinking na positive na sabi ko, once in a lifetime to Joey, you're paid, but you're funded by government, Philippine and US to study. Ayaw mo yan, gagraduate na ako in 4 months, I will apply for graduation actually this week. So
Wow.
yun. So sobrang positive thinking na lang talaga na parang after all this will be worth it. I will be, yung goals ko din in the future, like actually yung goals ko aside from yun sa medical education, I'm also part of the Philippine Society of Public Health Physicians. Bale, gusto namin i-push yung formal specialty of public health na parang it's a viable career options for it's a viable career option for doctors. And also with my career, with my training in epidemiology and research, na parang hopefully helping subnational research yung pag-conduct ng subnational health research. Like for example, sa mga ospital, I have a lot of resident friends na parang, shit, parang, sorry, nag-move. Parang,
That's
paano ba,
fine.
parang anong pipiliin kong statistic, study design, ganyan-ganyan. Paano natin aayusin yung research? Para, I mean, research is not everyone's cup of tea. And not everyone knows how to do research. Tapos parang sabi ko, it's a wise use of my training, my network, na yun, at least ma-offeran ng support kung anong makakaya ko itong mga doktor na to do. Kahit yung mga sa hospital, na sa RHU, kasi there are a lot of research questions that you can answer when you know when you know the methods. So part of
Mhm.
my agenda too, siguro in the next, I don't know, kung ilang years, is to also help capacitate these health professionals, not just doctors, on how to ask the proper questions, how to do proper evaluation and monitoring. At least yung mga basics lang. So parang para you're planting seeds, tapos para at least paunti-unti we know how to allocate funds. Kasi parang for example, isang RHU, parang may magko-conduct ka ng training on monitoring and evaluation, which is actually my minor dito sa Hopkins. Parang at least pag nag-budget si MHO ng pera, nag-work kasi ito eh. Kasi we did a formal evaluation in our own locality. Parang a formal process-based evaluation. So, ito yung popondohan ko for the next year because it works. It doesn't go into waste. And I think that's also a weak spot in public health na even a unit in the Department of Health said na parang hindi namin masyadong napagtutuunan ng pansin. So we also need help in that aspect. So yung mga ganong bagay, yun yung nakapag-direct sa akin kung ano yung kukunin kong majors dito sa Hopkins, yung tipong felt need and expressed need for
Right.
these. So hopefully ganun yung mangyari.
I think it's also a good opportunity for PCHRD. I mean, if I'd be curious to see what you will be doing afterwards. 'Cause for PCHRD, of course, they fund research na
Yeah,
maraming engineering also, and ngayon it's booming. Engineers have been requesting for fund to develop
yeah,
this tool and such, and it would be interesting to see a different perspective on for PCHRD to, you know, identify which projects would
yeah.
um, result to a faster ROI for them, faster utilization.
Actually, yun nga, I've been also reviewing proposals for PCHRD for the past year. So, yun nga, parang local health systems and public health perspective. So, I really try my best. I've reviewed proposals na wala talagang public health anything, pero they want to apply it in a GIDA, geographically isolated disadvantaged area. So I really try to incorporate or suggest mga implications of what you're going to propose. Kasi ito, we don't just propose things because we think it works. We want kasi na parang it's cost effective. We want
Yeah,
na it's wise use of our limited resources. It will really help people. It's effective. I mean, efficient is different from effective. Yung mga ganun mga bagay. So I just want pa sana parang yun to lead, parang to suggest and to lead them to thinking thinking in systems thinking. Now what they're going to propose is not just going to affect them, it's going to affect a lot of people, and if it works
right.
kasi it will be adopted on the national scale. So parang dami-daming
Yeah.
questions kasi. So ganun.
Yeah, I love that. And it just reminded me of this because I started, we will be offering a new elective in engineering this semester along with Dr. Wang in College of Medicine and Director Tejero in College of Nursing. And it's designed to be an interdisciplinary course between engineers and clinicians.
Mm-mm.
So parang the idea is clinical needs identification, and then for engineers, how do we design or how do we choose which problem we're trying to solve. And now that you
Yeah.
mentioned that, like naisip ko bigla na, okay, yeah, maybe we could have a talk about public health perspectives or community health perspectives, and how do we know which how to design a medical device or a technology from an engineering standpoint. And so this is what parang for us engineers, we want to para I think it would be helpful for us to know how do the health practitioners or public health professionals look at this problem, and do they look
Mm-mm.
at it the same way that we look at this problem. And that I think the intersection that we are looking for. So I love what you said about
Parang part of designing devices, it should be easily integrated in their daily routines kasi that's how they will accept it easily. Kasi sayang naman din ng mga innovations natin if they're just fearing it or just wala, parang hindi nila gagamitin at all. So it has to be yun, parang may cultural, merong parang cultural side to it na parang will this be acceptable for them for further use, will be easy na parang they don't have to stretch their like bend their backs parang o parang make efforts talaga to understand this because you know the reality sa ground na sobrang dami nilang programs na ini-implement. Alam mo yung ilang vertical programs meron tayo,
Mhm.
40 plus. Tapos parang isa pa yun sa iintindihin nila. So it must be easy for them to use.
Yeah. And siguro to wrap up, I have two questions. So una, what's next for your journey? You mentioned it a little bit earlier, but parang just to
Mm.
summarize it, what's next for you?
Ayun, actually, yun. So, I'm just finishing the remaining last two terms. We have 5 terms here sa Hopkins. So, last two. Midterms naman namin in 2 weeks, saka start ko pa lang ng third term. Kasi sobrang bilis ng SEM dito sa term dito sa Hopkins, 8 weeks lang. Every month may
Wow.
final midterms. So, in May, I'll be graduating. Hopefully, I mean, I have no choice but to graduate kasi scholarship requirement. I'll be graduating. I'll be flying back end of June to the Philippines. Siguro pahinga muna for 1 to 2 months just to, I mean, I really plan to go to, I mean, pending negative results, just go home and maybe just surf in Siargao or I don't know, Palawan kung pwede na, just relax. And then by the end of the year, get back to whatever work opportunity there is. I mean, I'm still tied to my my former agency parang I resigned actually, but they did not accept my resignation. so, so okay, parang you come work for us after. So okay, sabi ko, and but so I'm actually open to any opportunities, which I parang di naman din ako nagmamadali. But yun nga, I've also been recently elected sa PSPHP board. So one of the thrusts siguro, if I may, yun yung mga nasabi ko nga. So more of pushing for specialty development, pushing for, I don't know, at least just striking conversations with the right people on parang starting discussions on revamping medical education. Also, ayun, I mean, online discussions, at least sobrang ano kasi, active din naman ako sa social media, at least to spark interest
Mhm.
of students, young minds, to even consider public health in their career, or at least incorporate a public health thinking parang mode sa kanila. Even if they don't choose it, they at least know that it has a public health implication.
Yeah.
At least, so yun, parang bilang active-active naman tayo, bida-bida tayo sa social media, so why not at least share something. But sa ngayon kasi I don't share as much public health information kasi I don't think I'm that like that level pa na pa expert level. So I'm just at least focusing on browsing interest in terms of studying, and then improving their craft in terms of academics and training. So pagbalik ko, hopefully mga ganun. Tapos, yun, I'm actually super open to any opportunity, but definitely in the Philippines. It's not just because of I need to fulfill a requirement. I mean, I still have return service sa UP. I still have 3 years to fulfill. And I have 2 years na overlap naman sa Fulbright. So yun, but I don't really see myself in the immediate future na staying abroad. So definitely I will be seen more in the Philippine health scene. So yeah.
Nice. So yung return service with UP, is it like so 3 years plus 2 years of Fulbright? So is it 5 years return service in total?
Mag-overlap sila hopefully, because I still, kasi 5 years yung return service ko sa regionalization. I did 2 already, so the remaining 3. So overlap sila with Fulbright na 2. So 3 years na lang. Actually,
Three
required lang
years.
ako to stay in the Philippines for the next 3 years. But I think I
Nice.
want to stay for a longer time. I mean, I know
Yeah.
how hard it is to live here abroad. I mean, it's not my first time to live abroad na more than a month. I've been in the UK for 7 weeks. Pero ngayon, I mean, isang buwan pa lang ako. I mean, I realized na parang I'm fit more for to live in the tropics in the Philippines, where
Yeah.
everyone's just so sunny and smiling and everything. So,
Yeah.
definitely
Yeah.
that.
One question that I ask everyone that I invite to the podcast is three pieces of advice that you could give for Filipinos considering a similar track as yours, want to get into public health and medicine. What would it be? So three pieces of advice.
Siguro una would be to know your whys. Na parang, why are you taking public health? Why are you studying medicine? Is it for money? Is it for prestige? Is it for, I don't know. I mean, all are valid reasons, and wala naman tayong dapat i-judge doon na ano yung reason. But at least make sure that these reasons will stick for a long time, because mahirap din naman kasing at some point you will find yourself unhappy with it
Mhm.
kasi you were in it for the wrong reasons. Second would be to find mentors or figures or role models na parang you can at least parang blueprint, but not necessarily copying their career path. So proactively network. I mean, it's so easy to communicate these days with internet. So connect with the right people, make wise use of social media. So kasi sobrang nakatulong sa akin yung mga bosses ko and mentors ko. I wouldn't have been here today if not for them. I wouldn't have known how to do like technical proposal review or project management on my own from coursework. It's actually experiential learning, and yung patient sila sa akin to learn kasi patient sila sa akin while I'm learning. So yun, it's just to recognize that also hindi, you can't do things alone. You also have to accept your flaws and your kakulangan and your gaps. That also propelled me to study further because I know I don't know a lot. I think I will perform better. I will be able to give back better if I study because I know I lack these things. Siguro third, isipin ko na lang na parang don't think of timelines kasi. Magkakaiba tayo ng timelines. I'm 30 years old. Other people would think of it as parang, dapat may asawa na ako ngayon or ganyan-ganyan. Yung mga, pressures from outside world. But there's no set timelines actually. You can take your master's at 40, you can take it at 50, ikaw bahala. You craft your own destiny. And you don't need to be pressured. So, chill ka lang. If you want to do a PhD at 40, sure. Why not? If you want to take an MD after working for 10 years in an organization, sure. But yun nga, babalik at babalik ka sa why are you doing it, and hopefully you'll live a happy life. So yun. Also pala, last na lang siguro, wag masyadong magpatali sa career. There are other ways to there are other things to aspire for na parang it's not mutually exclusive, na parang kung nakikita niyo siguro yung profile ko on social media, it's not purely career oriented. There are also like personal, ganyan because I think may natutunan ko din sa class ko, there's all this expectations violations theory in persuasive communications, na parang when people when people see that you violate expectations, you tend to be more persuasive. Na parang, for example, doktor ka, tapos nakikita sa social media mo puro, research. Sure, that's expected of you. That brings your credibility factor. But then when they see that you are human too, you experience the same things as them, like yung mga love problems, good problems, that's totally fine because it adds to your authenticity. So credibility plus authenticity equals you are a more persuasive individual because they can relate to you more. They see you as more honest. So it's actually one piece of advice na natutunan ko din from school, na parang if you want to be more persuasive, you have to be credible and authentic. Which actually works kasi in the US, recently ko din na-tweet na parang they use social media differently, very academic, kanyan. But in the Philippines, we use it differently. So parang it suits the market then. If you want to be able to have, parang impact din on other people, you must at least consider these para you are also more effective in your advocacy and your cause. So I guess yun.
That is it for this chat. If you like this episode or would like to suggest a future topic, let me know by sending me a quick message. I'm always looking for interesting conversations and hope to share more similar stories in the future. My Twitter handle is at rocksalt, that's ROXSALT. You may also send me an email at rocksalt.acc@gmail.com. Thanks for tuning in and see you in the next one.